Dr. Meena Mishra possesses 15 years of experience as a radiation oncologist. She studied at the highly acclaimed Tata Memorial Research Institute, Mumbai. Currently, she is the chairperson of Brain Behavior Research Foundation of India, New Delhi, where a large part of her work includes integrating mental health in preventive oncology. Prior to here, she has worked with the Department of Radiation Oncology, Fortis Memorial Research Institute, Gurgaon, India. Again, your achievements, ma'am, run into many, and this is certainly not an exhaustive list. I will at this moment invite our second panelist, Dr. Mishra, to please share her thoughts on this matter.
Am I audible?
Yes, you are.
Yeah. Well, so good morning, everyone, and thank you, Dr. Debanjan. You have really emphasized what, as a medical person, I also feel that instead of psychiatry and psychology, we should be rather focusing on mental health as an overarching term. So I think everyone who is present here should be lauded for their contribution to mental health. And so we have come together on this platform today to celebrate the World Mental Health Day in the unprecedented war against an unseen enemy. Now, each one of us have won this war, and each one of us are still continuing to fight against this unseen enemy, which is the COVID-19 pandemic, of course. So I would take this opportunity to thank Amity University Dubai for giving me this platform to share my thoughts, again, on a very, very important topic and oft neglected topic as well, which is the geriatric mental health. Now, before I really begin my thoughts, this topic took me back to our ancient Hinduism, where the human life was assumed to be 100 years and it was divided into 4 stages according to the different age of life, like the studentship or the brahmacharya, the householder or the grihast, the vanprasth or the forest dweller, and the ascetic or the sannyas, depending upon the physical, the psychological, the familial, social, and spiritual needs. Now, among these 4 ashrams, the vanprasth and the sannyas basically related to old age lifestyle. And why was this created? Because it was intended to prepare for the next stage. So, for example, vanprasth was a prelude to the sannyas, because your different needs change with age. And it was a good system to maintain the discipline, the peace, and the harmony in the family as well as in the society, and served as a guide to lead a fulfilling life of self and to the society as well. However, this changing structural landscape over the years and a lot of economic, social, and familial changes have altered the system. Although it is still practiced by a few, but that is very few in number. So sustaining the older generation is largely a cultural context, I believe. So the goodness of society is actually reflected by how it treats its vulnerable sections. And these elderly population is one amongst them. So just having a look at the problem, the absolute number of elderly in India has increased from 97 million in 2017, and that is around 6% of the total population, and it is projected that by 2050 it's going to be around 20%. With the declining family size and increasing life expectancy, which we have now with our improved health mechanisms and the healthcare systems, it stands at 69 years. So in other countries like Japan, which has got the oldest population, it's around 28% of the total population, which is a significant amount. Almost 1/3 of the total population is an elderly population. So it is important to maintain their healthy living and productivity. At least these elderly population is able to take, self-care, so that the overall productivity of the economy is not hampered. And we all know how this works, and there is this United Nations Sustainable Development Goal, which is built on the principle of leaving no one behind. And so this principle of inclusivity, including each and every section of the society in their sustainable development goals, is an important aspect of the United Nations. And it has emphasized a holistic approach to achieving all these objectives. So, what are the problems actually? Why are we discussing this? Of course, there are certain problems that exist in old age, and it's a very complex interplay. The vulnerable, even the young children are a vulnerable population, but I believe that the elder population has a much more complex interplay because they have their own, own thought processes, but they do not have the means or the capacity to uh, achieve them. So there are the health problems, of course, at the very physical level that we see in the form of chronic illnesses. That could be anything from arthritis leading to, the incidence of cancer is much higher in old age. Then the second of all is the psychological or the mental issues, like dementia, which could be age-related, which could be pathological. There is depression, there is loneliness, there are other emotional issues. And I would like to stress on the emotional issues here, which is the most important factor to my understanding that guides all the others. The financial issues, of course, there might be poverty, there could be lack of financial planning in the young age. They might be running out of money, or they are more prone to frauds because of their fading understanding of issues. Then there is third, a very important family issues. They are either living with adult children due to any physical ailment. They are bound to live with adult children and adjust according to their family structure. Or there are so many elderly population who is still assisting the adult children with finances, and therefore that eats up their own finances at the end of the day. So what are the ways in which we can manage? So there was a very important approach that there was a thought that there is an individual approach is the best in elderly population. But then the United States came up with a new approach, which is that because the entire gamut of this population requires at least some amount of common requirement, so they came up with a population health strategy, which is a concept of health characterized by both objective and subjective determinants and health outcomes of a population. So, what are the predictors of the high psychological well being for older adults? They are social support, a physical activity, having a spirituality, and a higher socioeconomic status. These are all high psychological indicators. Whereas the social well being has been defined as the relative ability to deal with social challenges and how well one functions in the social world. And there are five important components of these social well beings, like the social integration, social contribution, social coherence, social actualization, and social acceptance. Now, after discussing all these problems and issues of in the previous section, how do we approach it? And this is the last part of my thought process. I think keeping in tandem with the current COVID pandemic, the PPI approach is what I feel is the correct way to go. So the PP stands for the prevention and preparation. Like Dr. Debanjan also said, that we need to start preparing. Prevention and preparation is the purpose of a lifestyle behavior intervention. That is the purpose. You have to start it as early as possible. You have to modify the poor lifestyle behaviors to improve the health, the physical health as well as the mental health, reduce the risk of disease, or slow the progression of disease. And the three major important relevant modifiable lifestyle behaviors are the physical inactivity or the sedentary lifestyle, so common in today's times, healthy diet, and tobacco usage. This intervention should ideally begin at, or rather, the prevention and the preparation should begin at birth. It should begin at birth, Dr. Dibanjan. This is what I, believe, and it starts with the parents, giving sort of giving healthy lifestyle advice and bringing up their children in that manner. They are so that they are preventing it at that stage, and once you reach 40, the preparation starts. So if there is obesity, you need to cut down on the weight. You need to, make dietary modifications. Yeah, start include doing regular exercises, and start preparing that even at the age of 65 or beyond, how could you be productive at your end? how to keep contributing to the society, and in what manner. Do you want to go full on, or do you want to curtail your job only to limit yourself to a social work? So it's all the preparation that starts after the age of 40 years. Now, what are the benefits of this PNP? I believe that the benefit is that it is cheaper. It is very, very cheap to introduce these measures. This can be done at individual levels, and no special programs or policies at the level of the government is required. And just to give you a glimpse, this International Yoga Day that we are celebrating, that has been taken up by the United Nations, is an effort. It's an effort to bring this message out into the public of preparation and prevention of lifestyle illnesses. And Swasth Bharat mission that we have in India is another attempt by the government of India to introduce the same thing, the same concept. Then the second, I believe, I stands for the intervention, that we all know, that we all are working in that field. So it is the medical management and the rehabilitation services. It is labor intensive, it is costly, and we achieve little benefit in terms of the hard endpoints. So I believe in the end, I would like to sum this up, that once you know the problem, you should target earliest to maintain the transition to old age in order to sustain the societal and the national architecture. Thank you so much.
Thank you, Dr. Mishra. Your views on the ancient cultural context in particular resonate with me personally, and I'm sure with many of the audience available out here today. I invite, with that note, thank you very much, ma'am.